A big shakeup on the horizon for the Oklahoma Health Care Authority. The director of the state's Medicaid program was fired this week, and more firings could be on the way.
A staff member is now sounding the alarm. She says the man Governor Stitt appointed isn't fit for the job. News 4's Dylan Brown joining us with more. What's up here, Dylan?
A whole lot. Kevin, Heather, over the past year or so, there have been many Governor Stitt appointees that just didn't work out, some even costing the state millions. A current lead staff member, though, came to us at the Health Authority, letting Oklahomans know the new appointee for Health Care Authority wants to clean house, and there's some concern about his past.
Do you think he's fit for this job?
I don't think he was the right choice.
Staff at Oklahoma Health Care Authority sounding the alarm on Governor Stitt's new pick. Clay Bullard was appointed as director Monday to lead the agency. You might remember him from the pandemic, Governor Stitt ordering the state to stock up on the drug hydroxychloroquine, thought to be a cure to COVID, but had little to no effect, the state eventually begging for a refund. Well, Bullard was a consultant behind the purchase of the drug. He now leads the agency in charge of Sooner Care.
When someone just flat out tells you from the beginning, and that's your whole job, is to stand up for the right thing.
Ginger Clayton is the current compliancy director. She's responsible making sure contracted agencies follow the law. She's been there several years. Wednesday morning, she says Bullard told them a shakeup is coming.
He told us what kind of leader he was, and he essentially told us that he does not want pushback, and then he proceeded to kind of go into more explanation about how we should be friendly with providers and things like that. And it isn't that we don't want to be friendly with providers, it's that, we still have a federal responsibility.
Just days after he started, Bullard already cutting one position, Christina Foss, the director of the state's Medicaid program. Clayton says more could be on the way.
I've heard rumors that as many as 8 to 9 could be let go. I have colleagues that are at fear for loss of their jobs.
It's a major change at a time when many nationally and here at home worry about the future of Medicaid.
Now, the Health Care Authority did confirm at least one person has been fired this week in a statement saying, quote, as with any leadership transition, changes are a normal part of the process.